first abstract is on Richter's transformation. Richter's transformation, and as you know, is a huge unmet need within the realm of chronic lymphocytic leukemia. So this study was a single-arm, multi-center phase 2 study of Venetoclax plus dose-adjusted R-EPOCH. This was conducted at 3 US sites: Dana-Farber Cancer Institute, The Ohio State University, and the University of Texas MD Anderson's Cancer Center. This was presented by Dr. Davids. CLL patients who had a biopsy-proven Richter's transformation to diffuse large B-cell lymphoma were treated with R-EPOCH for 1 cycle, and then after count recovery underwent accelerated inpatient Venetoclax dose ramp-up over 5 days, and subsequently they were treated with Venetoclax plus R-EPOCH for up to 5 more cycles, where Venetoclax was given for day 1 to 10 of each cycle, 21-day cycle. Subsequently, responders went on to allogeneic stem cell transplant if they were candidates for that, or they continued Venetoclax daily maintenance as long as they could. The study completed accrual with 27 patients. As expected in this population, high-risk features were seen, with complex karyotype and IGHV unmutated status, each seen in about half of the patients. Toxicities were as expected, with an aggressive chemoimmunotherapy. Grade 3 neutropenia was seen in 58% of the patients, with neutropenic fever seen in about 38% of the patients. Anemia and thrombocytopenia was seen in 50% of the patients each. Of note, tumor lysis syndrome was not seen with this regimen. Of the 20 patients who started the combination therapy, CR at end of combination therapy, which was the primary endpoint of the study, was 55%. In an intention to treat analysis, overall response rate was 62% with 50% CR rates, which is very compelling and encouraging given the poor historic responses seen in these patients. About half of the patients who were candidates for an allogeneic transplant went on to receive an allogeneic transplant. And the rest of the patients continued with the Venetoclax maintenance. Of note also is that the responses were durable both in the allogeneic transplant as well as the Venetoclax maintenance arm, with some patients 2 to 2.5 years out from initial treatment. So these are highly encouraging results for this patient population, which otherwise where we do not have a standard treatment. So this study is being further expanded with plan to explore Venetoclax plus R-EPOCH. So this was the first abstract. So in the frontline setting for CLL, initial results of a multi-center investigator-initiated phase 2 study were presented. This was a triplet combination of zanubrutinib, obinutuzumab plus Venetoclax. Zanubrutinib, as you know, is a highly specific next generation BTK inhibitor with lesser off-target effects and hence the possibility of lesser side effects, especially when used in combination treatment. In this study, zanubrutinib was given at 160 milligrams orally twice a day. Obinutuzumab starting at cycle 1. Obinutuzumab was also started at cycle 1 with 1,000 milligrams IV on day 1 or split between day 1 and 2, and subsequently was given, it was also given on week 8 and week 15 of cycle 1. In subsequent cycles from cycle 2 to 8, it was given on day 1. Venetoclax ramp up was started on cycle 3, day 1 in the standard fashion. Treatment duration was determined by a pre-specified undetectable MRD endpoint. MRD was assessed in peripheral blood starting at cycle 1 and then every 2 cycles. Once peripheral blood MRD status was determined and confirmed by bone marrow biopsy, treatment continued for 2 additional cycles. The study accrued 39 patients. All the patients were evaluated for toxicity and 37 patients were evaluated for efficacy. The most common treatment emergent adverse effects were neutropenia, seen in 51% of the patients, thrombocytopenia, seen in about 46% of the patients, and infusion reactions and easy bruising and diarrhea, seen in 41% each. Of note, tumor lysis syndrome was not seen, either biochemical or clinical. At the beginning of the treatment, 17 patients were at high risk, medium to high risk for tumor lysis, with 2 cycles of zanubrutinib plus obinutuzumab. This risk was reduced to medium to a mild to medium in about 15% of the patients. So the 2 cycles, as we have seen in other studies, similar studies, the pre-treatment before initiation of Venetoclax does reduce the risk of tumor lysis that we see with Venetoclax. So this regimen worked very quickly. At a median follow-up of 11 months, median time to undetectable MRD in marrow was 6 months. 62% patients have met the undetectable MRD endpoint and have stopped therapy at median of 8 months. So these are highly encouraging results. This regimen works very quickly. It will be interesting to see on long-term follow-up how these patients continue to do.